Following is a tutorial on how to set yourself up to use the EyeSi machine. Please contact myself, Dr. Muhammad Saad Asghar, to get your login ID set up. First of all, take out instruments from the drawer. Connect the instruments to the EyeSi machine. Make sure that the dot which is red is at the top and the colors are coordinated. Swivel the head up or down depending on your height. Raise or lower the machine depending on your height as well, and choose whichever seat is most comfortable. You ideally want to have your back and your neck straight to avoid any pain. You will notice two pedals at the bottom. The left pedal is for focusing and zoom adjustment, while the right pedal is for various other activities. It is best to take off your shoes to feel the pedals better. After making sure all plugs are switched on, press power on to start the machine. The system can take some time to load up, so please be patient. Once the login screen is on, please enter your login details. The green dot next to the cataract head means that the system recognizes successfully that the cataract head is attached. If the light is not green, giving a gentle push to the wire connect to the head might help turn it green. Do not pick up the head or pull the wire out of the head, as it may permanently damage the wiring. You will now notice beginner, intermediate, and advanced section. You will need to get through the beginner section to unlock the other two. Inside, you will find the relevant tasks. Go ahead and start the first task. You will notice that before you begin, on the intro screen, there is further guidance provided on how to do the task. I recommend clicking on the view presentation and seeing the demo video to further understand what you need to do. Once you click start, also shown to you is which colored instrument you need to use. Now look into the eyepiece. I would recommend keeping your glasses on if you normally do. Use the side dials to adjust the image until you get one image through both your eyes. Then use the pedals to bring the image into focus. Then use the zoom to set appropriate zoom level. In the corner of the image, you will first notice the text cornea and lens mentioned. Close one eye, turn the dial on the eyepiece until the text is sharp and in focus. Then close the other eye and do the same for the open eye. Now open both eyes and your view should be in focus and well zoomed. You are now ready to begin. To hold the instrument, use your dominant hand. Place your thumb and forefinger opposite each other and middle finger nearer to the tip. Use your pinky finger and ring finger to stabilize the instrument on the patient's head. If you don't have anything in your other hand, feel free to use your second hand to stabilize the instrument. Make sure not to tilt the instrument tip upwards while you are inside the eye to avoid hitting the cornea. The gauge earlier mentioned will show you how close you are to hitting the cornea. Try and keep the handle of the instrument vertical when you start. Insert the instrument into the eye while looking at where you're going, and as soon as you're inside, look into the eyepiece. Try to keep the pupil in the center of the field rather than moving the whole eye side to side. Then start this first task by slowly moving toward your target one by one, and after you are done, gently remove the instrument. It is quite easy to hit the cornea on your way out. Keep the instrument pointed slightly downwards while you do this. Click on finish tasks to see what you could have done better and how you scored. Proceed to other tasks as you progress. After you are done, shut down the system. Gently remove the instrument plugs. Place all the instruments back into the drawer. Don't remove the head, leave it as it is. Turn off the power on the wall, cover the machine with a cloth, and close the door of the room completely before you leave. You will need to contact myself in Ninewells Hospital to arrange the following. Number 1. Registration and authorization to use EyeSi at the ophthalmology department at Ninewells Hospital. Number 2. New EyeSi account creation. Number 3. Exporting of training data from EyeSi. And number 4. Access to the EyeSi room. Please familiarize yourself with the above protocol before requesting access to EyeSi, so you are able to spend your first session on more practice and less introduction. Thank you.